Hey, Madison. Okay, Lindsay says, Lindsay, it's so much easier for me if you will just talk to me rather than writing it in the chat because I can't flip back and forth all the time. But Lindsay says, also, do we need to fill out the medication forms for clinical prior to clinicals, or will we be doing that in post-conference? So this semester is going to be different, Lindsay, than past semesters. You will not fill out any paperwork in clinical, okay? You won't have med cards. You won't have anything like that. Number one, it's difficult to prepare med cards anyway because our patients, we don't know what they're going to be on until the day of. And I don't do patients assignments until probably the night before just to make sure our patient doesn't get discharged, right? So you don't know what meds patient's going to be on. Now, in normal setting before COVID, I would have students go ahead and fill out med cards for insulin because I know we're going to be giving insulin. But because of the pandemic, I don't want you to have any paperwork in clinical. So we will talk about all of the medication considerations that you would normally have on a drug card before we give medicine, but we will not be having drug cards with us in the clinical setting this semester because of safety. I don't want you in your PPE taking something out of your pocket under your PPE, looking at it, exposing it to virus particles essentially, and then putting it back in your pocket and taking that home. Does that make sense? So all paperwork will be done in post-conference. Okay, so we're recording, everybody. This is to talk about your community assessment. There have been a few people who have asked me questions about clinical, which I've been answering, especially if they didn't get to go to the clinical seminar last week. So they've had a few questions, and I've just been answering those as we go. I am about to start, I'm recording the meeting, and I'm about to start talking about a community health assessment. So if you are not in clinical tomorrow, or not tomorrow, Monday, if you're not in clinical Monday, then you should be working on your community assessment. And so I wanted to provide you guys a recording so that you know what to do and what your expectations are Monday if you're not in clinical. Because you have a good 8 hours there that you're supposed to be doing schoolwork that you don't necessarily have anything to do. So I want you to be able to get started on this before, I don't want you to have to wait on us to get started, okay? So I have emailed you all a document, well, 3 documents rather. I emailed you what is a community assessment. I emailed you resource websites as well as your groups. And I emailed you the packet that you have to fill out, okay? So essentially, this community assessment is an introduction to public health, okay? Public health and research. And so our goal for you with this project is I've assigned you all a community. So if you look at your groups, you are assigned a community, like right here, it's group 1, they're assigned to Morrilton, Arkansas. And that's just so we don't get all the same data about one community because that can get really boring in presentations, okay? You don't have to go to that community. It's a question I've been getting. You just need to look everything up online. Now, some information, some data in this packet will be on available at the city level, and some data will only be available at the county level, and that's okay, all right? So the first thing that you'll do Monday, if you're not in clinical, okay, is you're going to decide on how your team is going to communicate. That's the first thing. So I want you all to get together, whether it's group text, group me, email, I don't care, but you need some sort of documented communication method that everyone in the group has access to, okay? So it is not going to be okay if you come and tell me, well, so-and-so isn't in our group text, so we don't know what they're doing. That's not okay. Everyone has to be on the same page, okay? So Monday, that's the first thing I want you to do about your community assessment project is to figure out your method of communication, okay? Second thing I want you to do, you can decide who the team leader is going to be and then divide up the sections. This packet has 6 primary sections, and you can have up to 2 people in one section, okay? So the really big sections, like I think section 2 and 3 are pretty big, okay? You can have 2 people work on those if you want to, but those 2 people have to agree to work together. It's not a situation where one person does everything, okay? So if you have somebody in your group you like, you get along with, say, hey, let's do section 2 together. You know, it's kind of big, and that's fine. Okay. Or section 1's really big, so that's fine. I want you to tell me who the team leaders are, and I want you to have all the sections divided up. You have 1 month to do this, okay? So, but it should just take you 1 day, really. But this month, you need to figure out how you're going to communicate, who the team leader is, and who's doing what section, and you need to email that to me. I want 1 email per group from the team leader, okay? So that's your first due date. Second due date, I have assigned you a community, so we're not choosing communities this semester, because last semester everyone did Little Rock and it was quite boring when we got to presentations. So I have assigned you a community. You don't have to go to that community, you just have to look up the stuff online, okay? If you don't want to go, that's fine. So by October 1st, you need to have your health issues identified, which means everything in your section should be filled out by October 1st so that you can identify your health issues. Because what you're going to do is you're going to use this data that we have in the packet to identify the health issues, okay? So for example, if you're doing section 1 and this patient or this community doesn't have a college, okay? Say there's 0 colleges in this community, then you may say, okay, well, maybe that plays a part in our poverty levels. And maybe poverty levels are a contributor to some health concerns, okay? And so you're going to go through this data. The most helpful sections of this data to find out what your community problem is going to be at the end. It's called the mortality rates, should be. Leading causes of death. Okay, so it's part K in section 2, okay? In your population statistics, this would definitely be a section I would divide up with somebody, okay? But your leading causes of death and your communicable diseases. So part J and K are going to be your main indicators. So for example, in Pulaski County, HIV/AIDS is a major cause of, it's a major communicable disease, and it's a major health disparity. It affects quite a bit more minorities. And so that would be something that I might look at for Pulaski County. But when you look up this data, you're going to find out what your biggest health problems are in that area, what your biggest diseases are, and what kills the most people. And so you're going to choose a health problem based on that data, okay? So if HIV/AIDS was your /1 communicable disease, you can choose that health problem, HIV/AIDS, okay? And then what you're going to go do is you're going to research ways that people have addressed HIV/AIDS, okay? So you're going to go into your databases, and you're going to say, or you can do Google Scholar, PubMed is great, CINAHL is great, and you're going to type in keywords like rural HIV/AIDS interventions would be a good one, okay? Or public health interventions for HIV/AIDS. And you'll get a bunch of research, okay? And what I want you to do is look at that research and see how other places have effectively combat whatever communicable disease or mortality issue you've chosen for your community. So whenever you choose this, you'll say, okay, well, HIV/AIDS is a big problem. Let's go. Let's research. Let's go to Google Scholar and PubMed and CINAHL. Let's find out how other communities have addressed the same problem. And then when you find that out, that's going to be part of your interventions, okay? So if you find something that research says, or that's evidence-based, that research says works for a problem, then you're going to include that in your interventions. And that's essentially the point of the project, okay? The packet has instructions on what to do, and it's got the rubric has point values on everything, okay? But the big parts for you to get are your community diagnosis, identification of health problems, and your interventions. Now, when you go through this packet, you'll notice some of it is marked out. That's okay. If it's marked out, I want you to try to find it, but if you can't find it, it's not a big deal, okay? Like, I really don't care who the mayor of the town is. That doesn't impact public health at all. Okay. So if you can find that information, it's easy to look up online, great. Can't find it, do not stress yourself out about it. If it is not marked out, you need that information. Okay. That is information that will go into your grade. It's non-negotiable. But if you find something in this packet that you're trying to find, you can't find it, but you notice that it's marked out, it's something that I don't care about. Okay. So find it if you can, but if you can't, it's not a big deal. Like here, I don't care how many people have TV in their house because the internet is the main source of news. Okay. So if you can find the information, great. If you can't, that's okay. Now, where do you start as far as finding the information? This is the next question I usually get. I've put together a document with all kinds of websites for you. Okay. These are really good places to start. But if you're struggling, let me know. And I'll see if I can refer you to some websites to help you locate whatever data you're looking for. Okay. The next question I usually get, so you'll turn in this packet, and that's one part of the grade. The next part of the grade is the presentation. So you're going to do a 5 to 10 minute PowerPoint presentation over this data to present to the class. Generally, I ask for at least one slide. Generally, I'll ask for at least one slide per section. Okay. So I want you to have at least one slide for the 6 sections, all right? For your presentation, 5 to 10 minutes shouldn't be a big deal. You're going to present to us a summary, the summary and analysis you wrote of each section, okay? And then present to us what your community health problem is based on this data and the interventions you researched that are useful for that, okay? So you have a long time to do this. Like I said, your first due date is in 1 month. I need the community leader. I need you guys to establish a method of communication that everybody can do. And then I need you to divide up your sections, and I need the community leader to email me and tell me who's doing what section and who the leader is. One email, not 8 emails from each group member, one email, okay? Your second due date is in October, and I need your packet filled out by October 1st. And I need you to decide your community health problem you want to address, one problem, and then interventions, at least, at least 1 or 2 interventions, okay, that you've researched that has helped with that issue in other areas, okay? That's by October, and then November 1st, we are going to be done. Everything will be turned in. So each group will turn in, the leader will turn in 1 packet on the portal, and the leader will turn in 1 PowerPoint on the portal. And then we're going to present whenever your calendar says to present. I think it's sometime like November, sometime mid-November. And everybody's going to do a 5 to 10 minute presentation. You will speak on your parts that you worked on during the presentation. Okay. Now, let's do some what ifs here. If you have a group member that doesn't do anything, doesn't do their part, doesn't fill out their part of the packet, doesn't meet the deadlines, you need to email me, the group leader, 1 email. I need to know about that. We will do peer evaluations. So if everyone, they will be anonymous. So if everyone tells me in November that you did nothing, everyone in your group gives you a terrible peer evaluation, okay, and says that you did not participate in this project at all, then you have to redo the project by yourself in order to graduate, and you will have about 2 weeks to do it. So it is very important that you participate. You communicate with your group. If somebody asks a question, people need to answer because it's going to be in writing, whether it's text, whether it's email, whether it's group me, and people will screenshot and send me things and say this person didn't do their part and I'm mad about it. Every semester that happens, okay? So if you're not doing your part, understand that you will have to do this project by yourself in 2 weeks to graduate. So I encourage you all to do your parts, okay? But that would have to be every single group member saying, and, I'll have screenshotted information, proof that you are not doing your part in order to make you redo it. Because I don't want to do that, okay? But I want you guys to know going into this what your expectations are. That way you can meet those expectations and you can graduate on time without having to redo this by yourself, okay? Any questions?
What packet is it that we have to turn in, Ms. Linker?
It's this one right here. I emailed
That's
it
the one
to
you
you.
emailed. Okay. Okay. I was
Emailed
making
it
sure
to
that
you.
was the one.
Yep. It's the one I emailed to you. I've also updated the portal with the current documents of all these.
Okay. And so like at the bottom how it says summary to be complete, that's the section that we'll do as far as the summary. I think it's about 5 or 6 summaries that we have to do, correct?
They all have a summary.
Okay.
It's very important that if you do that section, you do that summary.
Okay.
You can't have one person assigned to the section, the other person assigned to the summary, because they're not going to know how to summarize the information that you looked up, right?
Okay.
Now, on the bigger parts, 2 people can work on those, and I don't care if you divide that up amongst yourselves. But if you do that data section, you need to do that summary. That summary needs to be written in the packet, and then your PowerPoint slide for that section will come from that summary.
Okay.
Okay.
And then how many slides does it have to be? About 6 slides, you said?
About 6 plus an introduction and so about 6 at least. Yeah, about 6 or 8. I only want it to be like a 5-minute thing. I don't want you to spend forever on this.
Okay.
But I do want you to work hard on the packet because you have 3 months, right? And you have 8, 16, you have 24 hours built into your schedule over the next month to work on this. So I do expect you to work hard on the packet. I expect the paper and the packet to be well done. But I'm not super worried about the presentation as long as you have the community health problem and you have research for why that community health problem is a problem. Okay, I need some data saying, okay, we have high mortality rates from heart disease. We have high mortality rates from AIDS. Okay, and then you have to tell me what interventions you'll think work because you found research that say they've worked for other areas. Okay.
Okay.
Those are the important things we need in the presentation. Your problem.
But we're all going to base it off one problem, though, right?
Your group as a group will decide, yes.
Okay.
And I want you to base that off of your mortality and your communicable disease, primarily, those statistics.
Okay.
Okay? So what kills the most people? What makes the most people sick?
Okay. And so we come up with that problem, though, right?
You as a group, yes. And then what you'll do is by October 1st, you will email me that problem and intervention to make sure I approve of it before you continue on. That way I can make sure that you're not choosing like gum on the street and the intervention is, to invent dinosaurs or something silly. Okay. So you've got by October 1st, you've got to email me your problem and your interventions, and they both need to be evidence-based or you can find research to support them.
Okay.
Okay. That way you don't have a bad project because I've already approved it. I know what you're researching. And then by October 1st, if you don't have something that's very good, I can help you come up with something better.
Okay.
Okay. Anybody else? Okay. I'm going to post this on your portal. You guys should have enough to at least get started on this for Monday. If you're not in clinical, if you are in clinical, don't worry about it. You guys will work on it next week. Okay? You have 3 months to complete this project. The deadlines are very clear. If you don't do it, you won't graduate. Your team leader, whoever you pick, needs to be very diligent about sending in the information that I've sent you in that email needs to be done by that day. Okay? If not, I will be calling you and I will be following up and I will say, hey, I never got your group stuff. You don't want to be the person responsible for potentially 7 people being behind. Okay, so if you're a group leader, please be very serious about sending the information that I've asked in by those deadlines. And the reason I created those deadlines is so that you don't get to the end of the semester and fail the project because you didn't have all your stuff done. Okay, that's why we have these 3 little deadlines to do. So we can all get it done, have a great research project, do a good job, identify people who aren't doing their part so I can intervene early so they don't end up having to redo everything on their own. That's really helpful when you have those little deadlines. We can kind of nip all that stuff in the bud before it becomes a problem where you're looking at not graduating. No more questions? Okay, I'm gonna stop this recording. I'll post it for everybody once it loads. Usually takes about an hour. But this is Introduction to Research, Introduction to Public Health. It's really important for you to get a good start on this so that if and when you continue on with your education, you'll know generally how this kind of stuff goes so that you can do a good job. Just read through all the information, ask me questions as we go. And if you're not in clinical tomorrow, identify a group leader, find a way for all of your group to communicate together that everyone can communicate in, and then figure out what sections you're going to do. Up to 2 people in one section. Okay. So unless anybody has any questions, I'll go ahead and stop this recording and post it. You're welcome, Linda. You're welcome, Amber. And y'all just feel free to ask me questions as we go. Okay. All right. And if you're in clinical, you should have got an email from me tomorrow. If you're in my group, and I will see you, or you should have got an email from me today, and I'll see you on Monday.